And we are live. Hello and welcome to the Wagner Students for Criminal Justice Reform podcast of November 4th, 2016. I'm your host, Thurston Powers, with co-host Sheba Rivera. This week we have Leland Reda-Eric from the Students for Sensible Drug Policy, chapter leader and founder of the Barach wing. And another guest from NYU, Alexander Lechtman, also with the Students for Sensible Drug Reform policy, rather. So, Leland, what does the Students for Sensible Drug policy do?
So Students for Sensible Drug Policy is a kind of like on-campus student-led nonprofit organization kind of centered around ending the war on drugs and attacking a lot of the failed policies that have come from it. We're an organization that doesn't really condone or condemn drug use, but we know specifically that young people are going to do drugs, and the policies that have come from the war on drugs have really targeted young people, and in a way we want to give people good information and start to kind of peel back those layers that's been built up over the past 40 or 50 years.
And what about you, Alexander?
So the question is, what does SSDP do?
Yeah, so this is what Leland's doing, and what you work with the NYU chapter. Do you guys do anything different, or?
Yeah, so and NYU chapter is very active. We do regular meetings where we talk about a range of different topics. We talk about harm reduction as it applies to drugs and drug use. We talk about policy. We've been talking recently about, and in the past, about ideas for on-campus policy change. And then we do other events. So we had a film screening early this semester, and coming up this month in about a couple weeks, we're going to have a Cannabusiness seminar on our campus. So yeah, that's just some of what we do.
I think one of the things that, in terms of framing, black market entrepreneurs, a lot of, conservatives want to support small businesses and entrepreneurship. You've got these kids who are quite honestly running small businesses better than I could, and they're like quite young.
Mm-hmm.
So what inspired you to do this sort of work, Leland?
Well, in a way I see my story as like almost typical in that I was actually an above the influence kid all throughout high school. But I was never one of those I was not overt about it, and I would never shame people, but I was always like, no, it's not for me. And then finally my senior year, I was in our high school play and there was this big party, and I knew there was going to be a bunch of drugs and alcohol. And I said, you know what, if it comes, I'll try it. And I smoked my first joint, and I realized that a whole bunch of everything that had been taught to me was crap. And so from there, I just became like really vocal as far as like, legalize marijuana. It's not hurting anybody. And I had been just kind of like my own spokesperson for a long time. And then I found out about SSDP through MAPS. I followed MAPS because I love psychedelics and I love everything that's going on in that community. And they said, start a chapter. And through building my chapter and doing a lot more research, I realized that there's a bigger picture than just cannabis, that there's this war on drugs, that it's targeting people who are black and brown, who are young. And so it's kind of transformed for me into a kind of multitude of things. But that's kind of really where it started, was that first joint just kind of like shattered everything I had been taught, because it was awesome and I still love it. And I haven't gone crazy just yet. Well, I may be crazy, but I haven't gone cannabis crazy.
Yeah, well, I'm really glad to hear that you all are coming in and educating the public about some of these policies and some of the changes that we could see. What are some of the costs to society of policing drugs that people don't usually think about?
Go for it, Alex.
Yeah, so the question is, what are the costs to society of policing drugs?
Mhm.
Right.
Right. So I mean, there's a lot of different ways that you can look at how our nation's drug policies impact society at large. Yeah, it's hard to even know where to start. So I mean, okay, let's start with families. So you're destroying families because you're putting all these people in prison for these nonviolent offenses. You're taking parents away from their children. Children are either because the parents are going into prison, or you're having social services taking children away from their parents because their parents use drugs. um, the incarceration itself has so many severe costs for society. So obviously there's the direct financial cost of maintaining the state, local, and national prison systems, or the jails. um, there's that, and then there's also the burdens and the consequences for people that are incarcerated, either while they're in prison or even after they get out of prison. So we know that all the different effects that this has on their lives. They lose the right to vote. It becomes more difficult for them to get a job, more difficult for them to get an education, get federal financial aid. um, and so it just kind of causes this cycle where a lot of them will there's a high recidivism rate, because they'll just, a lot of people that, for example, sell drugs and then get arrested and convicted for it, they get out of prison, however many months or years later, and a lot of them will go back to selling drugs because they can't do anything else to make money. So
Yeah.
Right. And you both have your work cut out for you, being in New York, which is one of only 2 states that will charge 16 and 17-year-olds as if they're adults. So yeah, really appreciate
Yeah.
you bringing out like the collateral consequences to society of doing that.
Yeah, I mean, we end up, I mean, we're end up having to front a bill that doesn't need to be there. And we just continue the stigmatization too of like drug user, and somebody who's got a criminal record. So you just kind of like it's a self-perpetuating cycle that doesn't seem to end.
Speaking of criminal records, I was at a bail reform hearing just yesterday, and one of the things that came up was sort of how we use criminal records to influence our decision on terms of setting bail. And so you can end up with cases where it's like 6th degree larceny, which is shoplifting, small, like under $200. And you can end up with a pretty high bail because you got caught with like possessing marijuana a few times. And one of the speakers was pointing out that bail should be set based off of, the concern about risk to the community and risk of flight, and the charge itself, not necessarily these like histories of like one time possessing marijuana at some point in their teenage years.
Mm-hmm.
So do either of you know anything about the percentage of the jailed population that is being held on drug or drug-related charges?
We actually looked that up, and I'm pretty sure we have the number for it, because I had to look up the exact number. I mean,
I have the doc if you need to. If you
yes. So for like possession, like just drug possession, and I believe this was 2015. Out of all like the drug, you have over 1.4 million, drug arrests, and out of those, 83% of those are just for possession. Like,
Wow.
so the vast majority of over 1.5 million people in jail are for possessing the drug, not even for selling it, not for transporting it, but just for having the drug.
Yeah, and one more thing about that statistic that you just cited. So, where is it? Yeah, so that 1.4 million. So this was for the year 2015. So there was 1.4 million arrests for drug law violations. That number comprised. That number comprised 13.8% of all arrests that year. And for comparison, the percentage of arrests for violent crimes that year was 4.6%. For property crimes, it was 13.5%. If we compare it to 1973, the percentage of drug arrests that year was 3.64% of all, or sorry, the percentage of, or I'll rephrase it this way. Drug offenses comprised 3.6% of all drug arrests, or sorry, of all arrests total in 1973. Violent crime was 4.2%. Property crime was 15.9% of arrests. So, basically, what that tells you is that in about 40-something years, the percentage of arrests for violent crimes and property crimes has been pretty much the same, but the percentage of arrests for drugs went from 3.6% to 13.8%. So,
yeah. And crime, it's just on this like 40-year trend of just decreasing. I mean, people have been talking a lot in the presidential race about pockets, certain cities that are having problems, like an increase in violent crime. And unfortunately, it is a result of prohibition. A lot of people, so for example, there was a Pew study that looked at Chicago, Colorado after it legalized marijuana. And one of the biggest problems they had, the stores, was that because they could not use banks, they had to carry a lot of cash. Right. And so they became prime targets for robbery.
Mm-hmm.
And it's like, if you work backwards, that's why there's so much violence in like sort of in the drug market. They can't use business insurance. They can't use banks. They have to act as their own police force to protect their property. And that's why you have territorial like fights and drug wars and violence. It's one of these costs that we don't really include when we think about the war on drugs.
Yeah, I mean, and if you go back to even just how we've labeled a drug user, is sometimes often a dangerous person, somebody who has, no inhibition. And we've kind of drilled that into people's brains for decades. And so you have a police officer who's already going into his job, even just on that end, somebody who's like, kind of violence, they're already hyped up for what may be happening, because he thinks, all right, well, this guy's got heroin, this guy's got crack, so he's going to be violent, he's going to be kind of all of these things. And so we, again, self-perpetuate this sort of myth and this, I don't know. It's like it's not, they're not super predators. That's a big,
Yeah.
It's you hear Hillary Clinton say, they're super predators. They're hyped up and all this.
Them to heal.
Yeah, you need to bring them to heal. I mean, just that statement alone is like bringing something to heal is an animal. You don't bring a human to heal. You bring an animal to heal, like a voracious animal or a horse that needs to be broken. Like, that's not how you treat a human. And so we've already created this bubble of like who they are. And so I can't expect a police officer to treat this situation well when he's already going into it thinking, I'm going to get hurt instantaneously. Like this is already a dangerous situation for me, no matter what drug it is.
Right. And do you feel like then implicit bias or it may come in and create sort of racial injustice when it comes to drug policy as well?
Of course. I mean, it does. I mean, what is it? The NY or the ACLU or the NYCLU just threw out some numbers, was it 2 years ago, on just on cannabis arrests. I mean, blacks are, what is it, 8 times as likely to be arrested for cannabis. Latinos are 4 times to be arrested. And so, and that's something we've done historically, is like, look, it's, marijuana with Mexicans taking our jobs and blacks with crack. But, I'll tell you something, that, who was doing crack before black people were rich whites, because they would buy a bunch of cocaine, they would cut it up themselves into these small amounts so they could smoke it. And then some business savvy person said, hey, I can sell these small amounts for less money. And that's how it gets there. But it's like, it's always like racially, like that fire behind it.
Right, and I think that same, I know that when the NAACP reported on that, they also accompanied with the report saying that whites are more likely to be using drugs, and comparing that to the fact that blacks are more likely to actually be prosecuted for using drugs.
Yeah, the numbers are like very small that whites are going to be using, like, it's for, at least for cannabis. The numbers are much smaller that we're going to be using them more. For the other drugs, it's a little bit more significant. But in general, yeah, whites are more likely to be using drugs, because who can afford to to be buying them?
What do you think about the changes that we're seeing in terms of just on the heroin epidemic?
Can you repeat that question?
So I think that there's a lot of focus now on how the so-called heroin epidemic is, taking over the suburbs.
Mm-hmm.
And do you think that the conversation around that is very different from the conversation around marijuana or crack in the 80s?
Well, I can only speak so much to that, because I wasn't alive at that time. But I think from what I've been hearing, from what I've been hearing recently about the talk about heroin and opiate use, I do have hope, because I see that it's being more and more discussed as a medical issue rather than a criminal issue. I just recently went to they did an event at the New York University Law School. It was about the opioid epidemic. They had a speaker panel. They had a federal prosecutor based in New York. They had a woman whose son died of a heroin overdose. They had a doctor, and then they had the director of the DEA diversion office. And I was actually pleased with the language that I heard coming out of the panel, that they were basically talking about heroin and opiate use in much, I guess, in better terms than I would have expected. They were talking about it as an issue, that requires a compassionate response. So there was a lot of discussion about, increasing awareness and access to naloxone, right, which reverses heroin and opiate overdose. There was a lot of talk about, diagnosing the signs of addiction or overdose, and basically knowing how to treat it. So I do see hope that we're moving in the right direction. But I think ultimately what we're going to need to do is we need full decriminalization. And at the end of the line, we need to legalize, because that is how we're going to mitigate the other, all these different dangers that we're seeing with, street heroin and opiate use, because a very large proportion of heroin opiate overdoses are caused by people either, mixing these drugs together, or not taking a dose that was larger than they thought they could handle. So I think that the policy of prohibition that we've had for the past 40 years has essentially made the problem worse, because you're forcing people to go to the streets to get these substances. They're getting them from dealers that don't necessarily have to meet, FDA regulations on the quality of the drug or, the dosage. So I really think that if we're serious about addressing this issue and moving forward, at the very least, we need to decriminalize.
What would you say the strongest counter arguments you've encountered are?
Well, I mean, the big one is that, you know, you're going to see an uptick in drug use. It'll be easier for children to get their hands on it. Those are kind of like the two big ones, is that, you know, by increasing accessibility, that you're going to increase usage across the board, which has not necessarily been the case when you look at Colorado. And some of the data that they've shown, at least on teen cannabis use, since they've legalized, I've actually seen a decrease in kind of like adolescent to teenage to young adult cannabis use. So that, you know, it's, you know, in one way you kind of take the fire and the excitement out of these things. But that's one of the bigger ones that I've been hearing and coming up against.
So in terms of convincing other people, I think it's fair to call drug usage and drug policing a complex problem. Thomas Sowell says that interventions for complex problems have no solutions, but rather trade-offs. What arguments have you been able to use to convince those on the fence that your trade-offs are better than the trade-offs that we currently have with the war on drugs?
So I guess I guess we have to talk about what the trade-offs would be to decriminalization and legalization, right?
Mm-hmm.
So you would be creating legal access to these, you know, potentially harmful addictive substances. You would, you know, you no longer have this, you know, you no longer have this incentive that, okay, I know that if I go out and buy this or use this, I'm going to go to jail. So, you know, potentially that could allow more people who might not have tried these substances previously, that now they see more opportunity to do them. So those are real trade-offs, but I think the benefits that you get for that is that, you know, specifically with heroin, you're ensuring that if someone wants to go out and purchase this substance, they can go and get it from a source that's regulated, and they know exactly what they're getting and how much of it they're getting. And if you look at, I just wrote an article about what they're doing with heroin in Canada. So they specifically about this clinic in Vancouver where they had a prescription heroin program for people that were severely addicted, and they found that just by providing the substance to them in a supervised medical setting, right, where there were doctors, there were nurses to monitor them, they had a support system, they had help finding employment, finding housing, with education, they had you know, emotional counseling to help them get their, you know, romantic or family lives back together. That when you provide all these additional services to people, that they're actually able to get their lives together and be healthier and actually, you know, contribute to society. And a lot of them actually are successful in kicking their addictions, rather than the opposite of that is you continue to criminalize the drug and completely bar access to the substance, and then you cause all these other issues, right? Because people are now being arrested, they don't have access to clean syringes, so there's a risk of infectious diseases being transmitted. You know, the list goes on and on.
So November 8th is right around the corner. What state ballots should we be watching? I know. I'm not looking forward to it either.
I mean, all eyes are on California, but I would urge people to keep their eyes that are in the Northeast on Massachusetts and Maine. Maine has a really liberal program that allows for home grows, allows for 2.5 ounce possession, and sets up a great regulatory structure. Massachusetts, very similar. You can't carry as much cannabis around with you. But the thing is, Massachusetts is a fairly populous state. Maine, not so much, but we're sandwiched. New York is sandwiched right in the middle. And so we kind of have a really good opportunity if these both kind of get passed, that we can press a lot of leverage on New York lawmakers. And already the governor of, not Rhode Island, I think of Rhode Island or Vermont, I can't remember which one, but he was already saying
Shumlin?
they already said, like, look, if these pass, we already have the bill written up and we're going to do it ASAP. Like, we're going to do it before the end of the year. So you already have some of these other Northeast states that are going, if this passes, we're going to lose a lot of money. We're going to lose a lot of business. And no state can afford that right now, which is why all of this looks really good. So I would look to those, but everybody's looking at California just for the size and I guess the overall impact it'll make in the U.S.
Mm-hmm. Yeah, California is really important, right? Because it's the most populated state in the nation, and also, I mean, this is just a cool fun fact that if California were a country and California legalizes adult use cannabis, California becomes the largest legal cannabis market in the world, which is really cool. And it's like Leland says, California. We've talked about this before, that New York and California are sort of role models, for better or worse in the country, and I want them to be role models for the better. So we're really hoping that if California passes this initiative, that we're going to see this domino effect, and more states are going to start legalizing. But I think the other important thing to keep in mind here is that, yeah, it's great that more and more states are legalizing. That's awesome. I want more and more states to legalize. But at the end of the day, we need legalization on the federal level, because that overrides all state laws, and we need to get cannabis descheduled, removed from the Controlled Substances Act. We need immediate decriminalization on the federal level, just to make everyone's lives easier, because we can't keep going with this half and half situation we have now, where banks can't, businesses in these states can't deposit their money in national banks, or they're living in fear that the DEA is going to come and shut them down. If we God forbid, if a certain Mr. Trump becomes our president, he said that he wants to take a hands-off approach to cannabis, but who knows what can happen.
Although Clinton and her daughter have both come out very hard against legalization.
Yeah, you know what? To any politician that's kind of coming up, it's now kind of, which has been awesome. It's kind of turning into almost a taboo to say you're against cannabis, because the numbers don't lie. And whether or not she is for or against cannabis, like, it doesn't matter. If the majority of states start, legalize, then the federal government's going to have no choice but to pass, because they're just not going to be equipped to do any sort of enforcement. And so I honestly don't care what either one of them say, because we're on the ground working to make it happen. And if it has to happen one state at a year, it's going to happen. It's not going to happen that way if these 5 states legalize, especially for California. I foresee in 5 years being the vast majority of states, if not half at least, having a legal regulatory cannabis structure.
Yeah, that's why I definitely prefer state government over federal government. Federal government's always the last to know that things are changing, and usually they're the ones in the way by the time it does happen. Well, thank you both so much for joining us. This is the second podcast we've had, and we are very glad to have you as guests, and hopefully we can have you back again soon.
Thank you very much for having us. I appreciate it.
And
before we go, I don't know if you want to tell people how they should get involved.
Yeah. So if you want to help legalize some states, we have this really awesome, easy phone bank, an online phone bank system set up. It's legalize2016.org, and you can phone bank online with your own cell phone. It sets up the calls for you. It has the script already written out for you. So you literally just have to hit the button and make calls, and it already sends the calls to whatever state you want to do. You can do California, you can do Arizona, you can do Massachusetts, Maine, whatever. That's like something you can immediately do. It's legalize2016.org. So LEG. Oh my God, I can't even spell right now. The day's been so long.
Thank God it's Friday, right?
Yes, legalize2016.org.
Yeah, and I would just add to that, if I can, ways to get involved. Just don't be passive. You know, if these issues are things that you care about, you know, I think it's your responsibility as a citizen to make your voice heard. And that doesn't only mean to go out and vote. Absolutely go out and vote, but don't stop at the voting booth. You know, find your local chapters, your NORML, your Drug Policy Alliance, you know, harm reduction centers in your cities, in your areas, ACLU, whatever it is, you know, Green Party, whatever it is, find people
Libertarian Party.
Yeah, Libertarian Party, Republican, whatever it is, seriously. Find people, you know, find the organizations, find the people in your area that are, you know, want to achieve the same goals as you. Go out, volunteer, you know, write for them, do research, do whatever it is, because it's only going to be through a concerted effort that we can really, you know, change this system.
And that is a very uplifting message
Yes.
to end on. Thank you. I sometimes when we talk about criminal justice reform and the war on drugs in particular, it can be a bit of a depressing topic, but it's always important to remember that we are very lucky to have been born or immigrated to a democracy, and we do have the power to change it. To our audience, thank you for listening. If you enjoyed what you heard, subscribe, and we'll keep producing. Thank you, and good night.
Thank you.
Night, everyone.
Thank you.
Good night.